Judith, you've been elected a new board member at this year's meeting. Congratulations on that. And you've attended many conferences of the EAPM already, and I was wondering what you think was special about this year's conference and which themes you think came up that are very important to us and important to the future of the EAPM.
Well, thank you for the congratulations first. In the last years, I find that this conference is the quality of the science is increasing, so that's really nice. So this year again, it was very good. And one of the new developments that I saw a lot at this conference and not before is ecological momentary assessment. So many people use diary studies, and I think this is one of the important developments because also we get a better grip of how patients differ from each other. So we can maybe use that for more personalized treatments for patients. So I thought that was very good development. Yeah, very interesting.
Good. Thank you. You yourself presented on functional somatic symptoms, and the title was Functional Somatic Symptoms. What do we think? What do we know? So for any other people that weren't able to attend your talk, what do we think and what do we know? What's the most important take-home message from your talk?
Yeah, we many doctors find it difficult to deal with these patients, and they also have all kinds of ideas that may make it even bit extra difficult, like that patients only want somatic interventions and that they do not want to discuss psychological issues, and they also think that if it's not physical then maybe it must be psychological, and many of the ideas we know from research are not true. So patients with medically unexplained symptoms or functional somatic symptoms, they do not request more somatic interventions than other patients, and many of them want to discuss psychological aspects of the complaints. So some of these ideas are in the heads of the doctors and not in the heads of the patients. And if we realize that, then it might be easier to treat these patients. So that would be my take-home message. And the other thing is medically unexplained symptoms or functional symptoms. Those patients may not have a detectable chronic disease, but their symptoms are just as severe and limiting as those symptoms in patients with chronic diseases. So we should really take them as seriously. So we should have also doctors that really are interested in it. There should be research money going to these symptoms because they are very common and can be very disabling.
Thank you. You talked a little bit about the implications that it has for treating these patients. Do you think there are important implications for future research on that topic?
Yeah, well, first of all, I think the number of researchers working in this area is relatively low given the prevalence of the problem. So I would like to invite more researchers to join this field. And I really would like to have more research money in this field. Specifically if you look at the prevalence of this disease again. And I think the new developments that we have seen in this conference also provide new research opportunities in which the heterogeneity in the patient population is much better recognized and can lead to more personalized treatments. So that would be my idea for research. And what I also see also in this conference is more and more qualitative research. And I also think that's really important because there are some aspects you can study with qualitative research much better than with quantitative research. Also the patient perspective, for example. So there were a few presentations about that, and I also find that a very promising development.
One last question. You've been involved in organizing a summer school this year. That was, I think, the first summer school of that type prior to the official conference. What was the main goal of this summer school?
Yeah, so we did that with the Euronet Soma network, which is a network of researchers studying persistent physical symptoms. So the summer school was on persistent physical symptoms, and it was for PhD students and postdocs, and we obviously had the goal to learn them, to teach them about persistent physical symptoms, but from interdisciplinary perspectives. And we also, a second goal was to form a network of young researchers so they get to know early career researchers, and well, maybe they could collaborate in the future and So they also had a nice time together, I think, and while learning about persistent physical symptoms and research skills. Yeah, and I thought the students were very enthusiastic, and we will see whether we do it again in the future.
Yeah, I heard only enthusiastic voices about it too, so hopefully there will be another one in the future. Thank you very much, and